Okay, root of neck structures after removal of more connective tissue and veins. So first, let me put back in place the subclavian vein that was mobilized, subclavian vein, the internal jugular vein. So this remaining luminal structure that you can see here, that's actually the right brachiocephalic vein, or the right innominate vein, which is formed by the internal jugular and right subclavian veins. So this once again is the phrenic nerve. Unfortunately, it was cut and damaged at its more distal segment. This muscle is the anterior scalene. The artery right beside the phrenic nerve, that is the internal thoracic artery, and like the phrenic nerve, it was unfortunately damaged or cut during dissection of and removal of the subclavian vein and internal jugular vein on this side. So actually a lot of connective tissue was removed during the cleaning of this area. So this is the brachiocephalic trunk, and the branches of the brachiocephalic trunk will include the right common carotid artery, and we have here the right subclavian artery. The right subclavian artery will actually pass behind the anterior scalene muscle. So this large nerve right here, again, the internal jugular vein is already taken out. So this large nerve right here is the right vagus nerve. So as you can see, it has a branch. It has a branch that will hook. It has a branch that will hook below the right subclavian artery. And what is that branch again? That is the right recurrent laryngeal nerve. So the right recurrent laryngeal nerve goes back up into the neck, branching from the right vagus at a higher level, unlike the left recurrent laryngeal, which hooks below the aortic arch. So the vagus nerve fibers that goes down into the mediastinum, they will supply a lot of structures in the mediastinum, the large vessels of the heart, the bronchial tubes, including the heart itself, the esophagus, etc. And let us retract the common carotid artery. So that nerve that you can see right here, this is the look what happens to the vagus nerve. As I pull, this is the recurrent, right recurrent laryngeal nerve, as it ascends to the neck, to innervate the larynx, which is up here. But before the nerve was mobilized, before the nerve was completely isolated, dissected, and mobilized, it is adherent. It is adherent to the tracheoesophageal groove. Where is the tracheoesophageal groove? This structure right here is the trachea. You can actually see the tracheal cartilage rings, and that one at the tip of the forceps, the structure that is grasped by the forceps right now, that's the esophagus. So the recurrent laryngeal nerve, no, is adherent actually, no. It is bound, no, by connective tissue, no. It passes along the tracheo-esophageal groove, no? So this organ or this gland right here, this is the right lobe of the thyroid gland, no? An endocrine organ which is responsible for metabolic, homeostasis, no, regulation of metabolism, no? So before we identify, no, the blood supply to the thyroid gland, let us first try to identify. We have a branch, no, of the subclavian artery right here, no. This branch of the subclavian artery is the so-called thyrocervical trunk, no. One branch coming from the thyrocervical trunk is the supraclavicular, no, artery. So the supraclavicular artery, as you can see, it was cut, no, or transected, no, after mobilization of the clavicle, no. That's the supraclavicular artery, no. This artery right here, that's the transverse cervical artery, another arterial branch of the thyrocervical trunk, no. So it crosses going to the posterior triangle, the floor of the posterior triangle of the neck, no. So that's the vagus nerve right there again, no. And then let's try to look at the okay, no. You can see the right recurrent laryngeal nerve again right there, no. And then we have this arterial branch, no. We have this artery coming from the thyrocervical trunk. Let me expose and show that to you in another angle, from another angle. So right recurrent laryngeal nerve, this artery right here, this is the inferior thyroid artery, no? Inferior thyroid artery, it's actually coming from the thyrocervical trunk also, no? So try to look at the area, no, where the inferior thyroid artery, no, enters the mass of the thyroid gland tissue, no. That's the inferior thyroid artery supplying this part, no, of the right lobe of the thyroid gland, no. As you can see, there's a small ovoid, no, that is tan yellow colored mass right there, no. That is another endocrine gland, no, that is embedded in thyroid gland tissue. That's one of the usually 4 parathyroid glands that we have, no. So that yellowish fleshy mass right there, that's the parathyroid gland, no. It's involved in blood calcium regulation or serum calcium level regulation. So that's the trachea. Once again, you can see the inferior thyroid artery also has branches that will supply the trachea as well as the proximal esophagus, no? That's the esophagus right there.